Healthcare provision in Uganda is hindered by a number of factors, including poor road network, shortage of health workers, delayed supply of drugs, among many others. Government has always worked with partners to plug the several gaps that exist in the healthcare sector. And for Environmental Alert, a local non-governmental organization, theirs has been to provide solar-powered lighting and training for village health teams or community health workers.
The solar system has been just one component, but we've had other engagements. We've had trainings of the village health teams that have been trained in reproductive health, and we hope they will help a lot into advancing the health services in these different regions. We're also training them on two livelihood ventures, such as at the end of the day, the youth in the area are able to handle different avenues, and then be able to benefit from some income generating activities that they can undertake as well. And also we've distributed a number of information materials regarding, again, reproductive health, regarding, of course, Ebola prevention. alone was also on COVID information, so we think this will help out into the service delivery here.
For example, during day, because they lacked lighting, they lacked power, energy in the sockets to probably charge phones, which would ease communication. They couldn't keep the vaccines, for example, even immunization vaccines, because that needed refrigeration, and a number of things automatically that need energy. So we looked around and we realized that that was actually affecting health service delivery. That aside from the usual problems of limited drugs or lack of drugs and limited medical staff, but also this access or use of energy wasn't there.
The project, running in 4 districts including refugee settlements, is also intended to conserve the environment through use of clean energy.
Environmental Alert has been able to install solar systems both in Kasonga Health Center 2, which is in the refugee camp in Changwari, and then Mwesigye Health Center 3. And for example, Mwesigye, about 17 solar panels have been installed. That is about with an attachment of about 6 batteries with a storage of, I think, of about over 30 kilowatt hour capacity storage. And the same as applied to Kasonga, about 14 solar panels installed with 4 batteries with also a very good capacity. And these batteries are actually lithium. We chose lithium because it has the capacity to last long, as opposed to the usual batteries that have been on market. Quite expensive, very hard to find good products on market, but we had to go ahead to source for some external companies, at least to be certain and sure of what we are going to provide to communities. So with this, it is going to be able to address the health challenges and increase public health service delivery, which was one of our biggest aims, because then we will see access to the health centers easier for both children and mothers, elderly people at any time. Then we've also provided the same energy needs to, for example, the staff quarters. So we know that where you have a healthy worker, you also have better service delivery, because
The health workers in the selected facilities say they feel more safer to work throughout the night.
It serves us so many things, ranging from lighting in the maternity section. This helps us to deliver mothers pretty well with minimal ease at night, and also stretches to issues of security. You know, gone are the days when the place was very dark, but now the place is well lit. Be it at night, we are able to respond to emergencies ranging from OPD cases to maternity cases. So I must say that it's pretty awesome for us to have these solar panels.
But the few who would come during the night would get issues with lack of light for assessment and for proper clinical judgment. And this would impact the life of probably the mother and the child in a way that it would take some time for maybe the midwife to make a proper judgment or to observe a complication that has happened earlier or early detection. So you find by the time they refer this mother, maybe things have already gone worse because we lacked the issue of element of right. Then we have some other investigations that we previously were not able to do, like microscopy, urinalysis, etc. We could not do them because we really lacked power. However, we had the gadgets, like we had the microscope, but not in use. Then the other challenge was our phones could be, sometimes when you're on duty, maybe your phone is off and you need to go to Karuguza to recharge your phone. So by the time you move, come back, or a complication or an emergency has happened somewhere, you find you're not maybe accessed and you cannot maybe give the help.
The team also met with the Parliamentary Committee on Environment and Natural Resources to advocate for use of clean energy. Walter Mwesigye, NTV.